Namaste. Good evening, everyone, and welcome to the 11th session of Webcares in collaboration with Apollo ProHealth. I'm Dr. Srinidhi Chidambaram, and it's a pleasure to meet all of you again. Let me begin with something that may seem familiar to many of you. She wakes up early, she shows up for work, for her business, for her colleagues, for her teammates, for her family. She pushes through fatigue, ignores the headaches, and adjusts to irregular cycles, maybe, and tells herself that this is just a part of life. But what if it isn't? Every year, over 500,000 Indians undergo preventive health checks to understand what's happening inside their bodies. For years, health checks meant just blood tests, some clinical examinations, maybe some vital signs, but that's not true anymore. Health checks must go further, and they have gone further. They do need to measure the heart's hidden plaque, the gut's microbial balance. They do need to measure the mind's quiet distress or the body's functional capacity or the impending diseases and the hidden risks. These startling facts have been seen in Apollo's Pro Health checks. These are the things that were measured, and we didn't stop with that. Apollo Hospitals and ProHealth looked back and tracked what happened to last year's healthy people. It looked deeper, it looked more intensely, and the data revealed what we didn't really know was true with the Indian population. And that was the Apollo's Health of the Nation report 2026. And it did reveal a very different story, which is what we are going to discuss in detail today with our experts. It did show, in a nutshell, that health risks are starting earlier than ever before. And for women, health risks just don't increase with age, they evolve and stack up like dominoes. By the age of 40, only 7% of individuals are disease free. The most critical decline and the increase in risks happen between the ages of 30 and 40. So, for the women entrepreneurs in this room, all this matters a lot because your high performance should not come at the cost of postponed health risks, not addressed, not prevented, not reversed. And to help us to decode the truths that have been uncovered regarding the health of our nation, I am really happy, delighted, and honored to welcome three dynamic clinicians from Apollo Hospitals: Dr. Asha Mahilmaran, Dr. Meera Raghavan, and Dr. Srividya. Dr. Asha Mahilmaran is a senior cardiologist at Apollo Hospitals in Chennai with over 20 years of experience in managing a wide range of cardiovascular conditions. She specializes in preventive cardiology, cardiac rehabilitation, advanced heart disease management. Her expertise spans complex conditions such as acute aortic syndromes, arrhythmias, and coronary artery disease, strong focus on early detection and personalized care, and just the right person to tell us about the cardiac risk factors that have been uncovered in the Health of the Nation report. Thank you, Dr. Asha, for joining us. I'm also delighted to welcome Dr. Meera Raghavan, who is a senior consultant urogynecologist and robotic surgeon at Apollo Hospitals, Chennai, with extensive experience in gynecology, pelvic floor disorders, and minimally invasive gynecological surgery. With over 2 decades of clinical expertise, she's also a trainer on robotic platforms and plays a key role in academic and surgical training programs. Her work spans clinical care, but also a lot of education and leadership within national gynecological societies. And she's going to be a valuable resource today in helping you to understand, particularly about women's health issues that have emerged in the Health of the Nation report and what you can do to prevent and reverse them. And I'm also extremely delighted to welcome Dr. Srividya, who is our medical director of preventive health services at Apollo hospitals with over 20 plus years of experience in internal medicine. An expert in preventive health, diabetology, and women's wellness, she focuses on early risk detection and long term health management, has played a key role in several large scale preventive health initiatives, and contributed significantly to even the pandemic response efforts in Tamil Nadu. And she has, of course, had a great role to play in the Health of the Nation report itself because it is part of the whole preventive health and pro health program. So I'm delighted that she's been able to join us today. Doctors, thank you so much for being here today. And I'm going to directly start with the big picture. So I'm going to start by asking Dr. Srividya about the Health of the Nation data itself. Um, this report that we have seen, which you have been an integral part of, does it reflect the women that you actually see in everyday practice? Are you looking at a silent buildup of risk?
Absolutely, Dr. Srinidhi, and thank you very much having us all on this platform. It is very, very exciting to address the women entrepreneur of India. To go back to your question, yes, health of the nation has been a very, very critical analysis which we have done because it's becoming very alarming year on year to see the rising NCDs. It does reflect the Indian ecosystem of a working woman, definitely. I will not say that it is reflects the rural or the semi-rural, but a lot of urban working women, including those women who are part of our CSR projects, who have been checked at schools as teachers, as parents, which we are doing with Apollo Shine, which is our integral part of our children's screening. So, yes, this very much reflects today's Indian working women from various levels, stratas of life.
So I'm going to get into some of the details now. Also, I wanted to tell you that there will be questions which we have already received from our participants, as well as some which might be coming in now, and I will just add them on as we go along. But let me ask Dr. Meera. So one of the findings in the Health of the Nation report is about deficiencies, particularly in women in their 20s. So it does show that there is a B12 deficiency that has showed up. And among schoolgirls tested, there were 1/3 of them who were anemic. So I would like to ask you, because these are years in which, people are at their peak of education, fertility, reproductive years, and so on. So what do you think is happening, and why do you think this is happening, and what can be done to address this?
Thank you, Dr. Srinidhi, and very glad to be part of this whole conclave, actually. Yes, in India, I think a third is just an underestimate. We see more than 50% of our adolescent girls being anemic, either due to iron deficiency or due to B12 deficiency. The iron deficiency primarily due to a nutritional aspect and also a much more prevalent worm infestation, which is not diagnosed, not picked up, and not treated fully. Though the schools have programs for deworming and iron supplementation, it's still not fully utilized. The other thing is about menstruation. If they bleed heavily, that goes unnoticed, or they assume this is how the normal cycle would be. And the lack of awareness and education about menstrual hygiene, the supplementation which needs to go with that, all contribute to a significant degree of iron deficiency anemia in our younger population. And younger adults who are anemic remain anemic premarital moms, and then when they reach motherhood, they're even more anemic, and this continues so on and so forth. It becomes a risk factor for the rest of their life. And B12 deficiency, again, could be a factor with the rising population of polycystic ovaries, and they go on metformin for that, and metformin causes B12 deficiency, further contributing to an increased number of people who are having these vital deficiencies.
So I just wanted to ask you here, is that also something to do with, this is not necessarily the case, right? I mean, in only in a particular socioeconomic strata, do you also see a lot of it in the upper and upper middle class? And do you think that's because of this preponderance of people eating selectively or cutting down on certain food groups? There is
Absolutely.
always so much of body consciousness and all kinds of things floating around. So, what would your views about
Absolutely.
that? Does that
Absolutely.
contribute?
Absolutely. Malnutrition is not strata specific. It happens in any kind of social or economic strata because some have deficiencies, others have oversupply of one particular macros and are deficient. It's basically a lack of awareness and application of a balanced nutrition, which leads on to these deficiencies. And this is universal. It is not applicable to a particular, strata, and it is more common in urban population compared to the rural population,
Right.
which is what I'm seeing.
Right. Dr. Asha, I wanted to ask you about yet another finding in that report, which says that nearly 45% of asymptomatic individuals have shown coronary calcium. So I would like you to explain to our viewers what is that and what does it indicate and what does this mean for heart-related risks, and is this something that our women should be more cognizant of, because we don't normally associate women's health with cardiac. And secondly, I'm sure our viewers would like to know what this coronary calcium is and how is this measured, because this might not be that evident in blood tests or just clinical examination. So what would your take on this be?
There's always been a myth that women do not have cardiovascular disease. But worldwide, women die of cardiovascular disease, and that is the number one killer in all women. It is much more higher, several-fold higher than a breast cancer risk or a cervical cancer risk. And the very unfortunate thing is women are more aware of breast cancer risk, they're more aware of cervical cancer risk, but they seldom think that they are aware of their cardiovascular risk. And this is what made in US coined the term Go for It. The campaign was formulated for this very purpose, that women should be aware of their cardiovascular risk and start looking at their cardiovascular risk more significantly. And the calcium score, what actually it does is, it is a very simple test. It can be done in a few seconds, and it does not take much of radiation. And all that it does is it will screen your heart and then tell you how much of calcium is deposited. And what is calcium is basically the cholesterol, which gets more hardened and becomes the calcium. So the calcium score varies from 0 to more than 1,000. And depending on the amount of calcium deposited, you can quantify the risk. And if your calcium score is 0 and you're not a smoker or you don't have a family history of IHD, then you are at a lower risk. But if your calcium score is above 100, then exponentially the risk starts going up. And more than 400, significant risk is there. And more than 1,000 means it's almost like you've had a cardiac event. So this kind of risk stratification is possible in patients by doing a calcium score. It's not recommended in patients who are at very high risk. If somebody has already had a heart attack, somebody has diabetes, hypertension, dyslipidemia, you know that they're already at high risk. You don't need calcium scores to risk stratify them. But the patients who are at intermediate risk, that is, they have one or two risk factors. They have hypertension. They are only 40 years. They want to know whether they need to be on a cholesterol lowering medication or not. So by doing a calcium score, you can risk stratify them better. If their calcium score is high, then you know that these patients need to be aggressively treated for their dyslipidemia and other lifestyle modifications needs to be done more aggressively. So what calcium score basically does is it re-stratifies patients who are thinking themselves as at low risk or intermediate risk will be eventually allotted their right risk profile. So this is what calcium score is all about.
We have two questions. Divya is asking us what test is it? So uh, I guess she's asking where does one get it? What
Get
kind
it
of a
done.
test is
Yeah,
it?
it
And
is.
another one, I'll just finish the other one, which is related. So asking what age should we get this test?
Yes, very pertinent questions. My appreciation for the questions, first of all. The first question is it's done in any place which can do a CT scan. A reasonable CT scan and a radiologist who can interpret a CT scan and can interpret your CT calcium score. So this is what is required basically. A CT scan is done on the heart and it's a screening test. It's not a one which is given dye and everything. It's just a screening CT which will tell you how much of calcium is deposited in the coronary arteries in the heart. And this is given by a score. The score can be 0. It is stratified as 0 to 100, then 100 to 200, 200 to 300, and 400 above. As I said, 0 and means low risk. If it is more than 100, it is higher risk. More than 400 is very high risk. This is how you interpret the CT calcium score. And it is recommended in patients who have multiple risk factors or one or two risk factors, and you're not very sure whether you need treatment for your cholesterol, how much is your cardiac risk, you don't know. So then the CT calcium score helps you in identifying accurately your risk profile. And this is recommended after the age of maybe 40, because not in the reproductive phase where you don't want exposure to any kind of radiation if it can be avoided, but anybody above 35 to 40, you can do it. In very old age, anybody will have calcium scores. So again, if you're above 70, it's not recommended. So ideally, the age group between 35 to 65 or 70 will benefit maximally from this test.
Thank you, Dr. Asha. Let's now focus a bit on what women actually perceive about their symptoms and health. And Dr. Meera, I wanted to ask you, Dr. Meera?
Yeah.
Yeah. So just wanted to ask, there are times when we normalize things all the time. So fatigue is it's just hot weather, or irregular cycles is due to stress, or, everything is, we always have this tendency to give these kind of explanations to our symptoms. But it's almost as if women have learned to live with discomfort, with the pain of period, with headaches, or with tiredness largely. What would you like to tell our women? How this can be not necessarily true.
Absolutely. The very fact we started the conversation that people resign to the fact that's how the periods are going to be leads on to persistent excessive bleeding and then subsequently to iron deficiency anemia. This is just the tip of the iceberg. Similarly, women reconcile or resign to the fact that fatigue is part of a busy day or the multitasking they need to do, or headache is part of a very stressful day, and lack of sleep is because they're managing too many things. When all these signs could subtly point out to a much more sinister problem which is brewing underneath. So, persistent headache could be a manifestation of a very high systolic blood pressure, which potentially can lead on to hemorrhage inside the brain. And similarly, chronic fatigue could be a manifestation of iron deficiency anemia or other kind of anemia. And ill health in general. And numbness and tingling could be a sign of chronic diabetes affecting the nerves. And lack of sleep could be perimenopausal or in the immediate postmenopausal phase, and that could lead on to problems. Being a urogynecologist, I would like to emphasize the fact that people assume that frequent urination is a part of either aging, menopause, or due to diabetes. None of this is true. It could be related to the bladder, which is acting up, known as overactive bladder, which is easily treatable and can be controlled. But the amount of impact it has on a day to day life of a woman who's especially multitasking and extremely busy, you need to speak to one to understand the impact. It's so embarrassing socially. They just do the toilet mapping all the time in their heads without the knowledge of it. And they're so relieved that they find the toilet very close by to their meeting rooms. So it's very, very important for us to pick out these subtle signs. If anything persists beyond 2 weeks, it's time you see the specialist. If it goes beyond that, it could mean something sinister. If it's not going away, it could mean something sinister. Snoring, which people assume is an aspect of sound sleep, itself is wrong. Snoring means your supply of oxygen to the brain is not so good, which means you can lose control of your bladder and can have bedwetting. So, bedwetting in the elderly can be a sign of a bigger danger than just hygiene or a social hygiene issue. So many factors which people resign or reconcile to the fact that it could be just part of aging or just there might mean something bit more deeper.
Absolutely. I think that's such a valuable message, Dr. Meera, that, always seek medical help. I mean, you have so much of medical expertise around you. So there's really, like, as she said, anything that goes beyond 2 weeks, you don't need to diagnose it or treat it all by yourself. You can take medical help, and most of these things are reversible and treatable. Dr. Srividya, I'm going to now move on to a very interesting finding in our Health of the Nation report, where we found that 74% of fatty liver cases had normal liver enzymes. Now, this leads to a larger observation that most people are not very clear on what exactly a good health check program should encompass, because for many people it is just about going even to a lab and doing a few blood tests, or if somebody is already diagnosed with diabetes, they may be just going on repeating just their blood sugars without testing other things. So there is a bit of a misnomer on what a health check program is, because these things are happening throughout the country, and they're not all the same. All health check programs are not equal. So health risks often remain quite invisible unless you screen it comprehensively and properly, and might even give a false reassurance to patients thinking that this is enough. So I would like you to explain to our viewers, using this finding, as to what exactly people should do when they say that I have screened myself this year, I've undergone my annual health checkup and I'm fine. What does it really mean? What is really fine and what is, not enough?
So, Dr. Srinidhi, you've just touched on a very raw area for me. I've been a practicing health check physician for the last 22 years. And the most glaring thing which women come, or most people come and say is that, what, I have done my annual health check. And many of them come to us saying that I did health check, I saw the reports, everything looked normal, but here I am ending up with a heart attack. So let me go and sue the lab. So let me go and tell the doctor who just said everything is normal. So this is where we believe as a science that we need to go beyond the reports, because there are certain genetic modulation which has happened. We have been ignoring, or we have been living in a world of denial ki I am fine. So the first thing which I will say is that being fit is not being healthy. They are two different things. So even if your fitness, you are a good physically active, eating right, eating, sleeping well person, you still need to ensure that you are healthy. And that is something which goes beyond the lab test. What does the lab test not reflect is the underlying subclinical smoldering lava, the volcano. Like Dr. Srinidhi said, the fatty liver is something which year on year we see in ultrasound, and it goes from grade 1 to grade 2 to grade 3. Diabetes is one of the commonest cause of non-alcoholic steatohepatitis, which used to be called as NASH. We have moved on to a different level of nomenclature to be simple, very fatty liver, which is one of the commonest cause of liver failure and liver transplant today. Fatty liver in people who are pre-diabetic and their liver enzymes are normal is a heralding sign that something is not right in your body. All your storage is getting dumped in your liver. The liver is facing a very, very big challenge of being overloaded with excess sugar, excess fat, and excess protein also maybe. But end of the day, it is the fat which is getting accumulated in the liver, and then it moves on to also your dissolved fat around your body. So it fully reflects that you have been ignoring fatty liver, and had you made the corrective lifestyle changes, you would pre-diabetes would have stayed at pre-diabetes or even reversed to non-diabetic status. So what is the ideal health check? Which tells you that, okay, your blood test looks normal, but there are certain signs that you have a mild dip in your MCV, which is your red blood cell size, which says that maybe you're going towards an iron deficiency, eat more greens. Same with fatty liver. Look at reversal of fatty liver, not by medication, but by lifestyle and diet to ensure that you don't go into a liver hepatitis phase of that. Similarly, when we talk about cognitive brain assessment, that is something which nobody thinks that multiple NCDs as we growing old, growing at a cellular level reflects in early dementia. We are able to pick up with showing what is your emotional quotient, what is your executive intelligence, how do you need to ensure with a 15-minute questionnaire of doing what we call as cognitive brain assessment. So then there is flexibility and strength assessment, which is also supposed to be part of a health check, which tells if you are not balancing correct, something is not right at your muscle level, your cell level. If you're not stable, if you're sarcopenic, many of these things go beyond a regular and a routine lab parameter. So it's just not enough to have year on year lab report, which eventually we throw it in one corner of the room only to be picked up the next year, and we see that it has progressed from HbA1c of 5.7 to 6 to 6.5, and then you end up in the treatment range of 7 plus, and nobody discusses about it.
I'm going to open the chat to see what questions have come up now. So there are a couple of them. So Sri Lakshmi asking, how can I tackle my daily fatigue? Can I give that to you, Dr. Srividya?
Oh, yeah. Depending upon the age, the daily fatigue could start from having too much of carbs in your diet, not able to sleep enough, not enough hydration in your day. So at least 3 liters of water. One of the ways to ensure you're drinking enough water is to say that your urine should be the same color as your water. That is one. If it is chronic fatigue syndrome and you are a perimenopausal woman, check your calcium, vitamin D, and B12, and that can be easily corrected. Anemia is another thing which can be corrected. So, at different age group or different decades of life, we find out what is your reason. It is a very personalized cause for a fatigue. It may be just you're mentally exhausted, you're maybe physically fine, but you're so mentally exhausted that you're not able to overcome it. It could be as simple as that.
I think this ties in with what Prachi is also asking. I'm in my late 20s. What health risks should I actually be thinking about right now?
So 20s are typically the reproductive age group is what we say. So you need to check whether your periods are regular, if your hemoglobin is fine, are you B12 deficient? Because this B12 deficiency is not only dietary. Our Indian soil is deficient in nutrient right now. Indian water is deficient in nutrients. So it's going to add and have a dominoes effect over years of life. So at the 20s, very simple. Hemoglobin periods are normal. Are you putting on weight? Are you losing weight? Check why it is. It is not everything is hormonal. It could be a cortisol high or a stress high. Are you sleeping well? Couple of four things which we call as a roti kapda makan. That means, are you sleeping well? Is your gut behaving well? You're not having any loose motions or altered bowel habits. No weight fluctuation. You're drinking enough. You're sleeping enough. I think that should be a very good trigger, what we call as health risk assessment. Just take a couple of those 5 questions, you will have your answer.
Right. Dr. Asha, there are a lot of questions coming your way, but let me first ask you about, things like we already said that, these days we are seeing hypertension or dyslipidemia, high cholesterol. These are diseases that initially were thought were of a much later age, maybe not affecting women so much, but now we see a lot of this report also has showed that nearly half of young adults are showing these early markers. So do you think that, and we're also seeing that at an average age of just 38, peak of one's productive years, we are seeing a high metabolic risk. So is there a younger heart risk at risk population now? Is there a new baseline? And I'm going to tie this in with questions from Jyotika, who's asking, how can I prevent cardiac disease? Her father has a stent. There's also another question from Swasti, who says that I don't have symptoms, but how do I know if something like heart disease is quietly building up, which is exactly what I asked you. So we'd like to club all this together and
Yes,
ask.
yes, Srini. What we are finding is in general, compared to the Western population, Indians have coronary artery disease at least 10 years younger. So what we were looking at as 60 plus in the West was 50 plus in the Indian population. But what is alarming is more and more even younger population, like the ones in their late 20s, 30s, are beginning to develop heart attacks and heart disease. And this has definitely been of concern. And by looking at population surveys, we found that the major risk factors like hypertension, diabetes mellitus, dyslipidemia, obesity, lack of physical activity is widely prevalent right from the adolescent phase. And this slowly builds up over time. And what is pre-diabetic in an adolescent or a young adult becomes diabetes by the time they are in their mid-20s or 30s, and they tend to develop. And what has been shown is early onset diabetes. That gives more target organ damage and cardiovascular risk rather than a late onset diabetes. Somebody develops diabetes in 20s, then they are likely to develop the complications early on in their 30s itself. And in fact, today I had a patient who was 37-year-old with a heart attack, and he had multivessel disease, and I had to do a multivessel PCI. So which means that, and this patient was a diabetic for about 4 years. So this is one of the things which you see, early onset of risk factors because of probably unhealthy lifestyle options. We are becoming more and more food redundant. So your choice of food going more towards fast food and avoiding too much of exercise because of the comforts in the society has today in terms of travel. So if you can travel by car, why would you want to walk? That is kind of the attitude. And so many a times physical activity is going down, screen time is increasing, and unhealthy food choices, packaged food, processed food are increasing, and buying from or restaurant food can be an event once a month or twice a month. But if it becomes every day, then you have unhealthy lifestyle choices. And all this is contributing, and no time for exercise because of the social pressures, performance pressure. Everybody is in a competition. Everybody is trying to compete with the other. There are so many competition exams. There are so many other distractions that time for physical activity, time for physical enjoyment in terms of physical playing is all coming down. And that's probably one of the reasons that our youngsters are beginning to develop these lifestyle diseases. And coming to the questions, I think one question was, how do I know I have a heart disease? So basically, you need to first of all look at your basic profile. Is your blood pressure under control? Are you overweight or obese? Do you have diabetes by measuring your fasting blood sugar, postprandial blood sugar, and the 3 months average HbA1c, which should be, if it's normal, it should be less than 5.5. So you look at these parameters and your blood pressure should be less than 120/80. So look at the basic parameters, your cholesterol levels. If these are high, then, and you have a family history, then you need to probably go for a calcium score, which will tell you if you're at a high risk or not. But if you don't have any risk factors and you're at low risk, just intensify your lifestyle changes and maintain a healthy diet and healthy exercise habit, and that should be sufficient. And one more question was regarding what tests should I do? Was
Yeah,
that
what?
when I'm 20?
Yes. No. That was,
No.
I think it was about the father having a stent and how would
Okay,
you prevent.
father having a stent. So very important is familial dyslipidemia. What you need to look at is whether the cholesterol levels are running in the genes, whether it is what we call it as low density lipoprotein, the LDL levels. So sometimes these are genetically determined. The number of LDL receptors in the liver are genetically determined. If your family has low LDL receptors, you tend to build up the LDL, low density lipoprotein cholesterol in your blood. So if it is more than 190 milligrams per DL, it is likely to be that it is genetically determined. So if your father has a heart attack, you need to first of all do your lipid profiling and see if your LDL levels are very high. If it is high, it is probable that you have a familial hypercholesterolemia. Another important risk factor is lipoprotein little a. So this is measured once in a lifetime and it is genetically determined. If this lipoprotein little a, it should be normally less than 30. But if it is like high 50, 60, or even 100, then it means that you have a genetic predisposition. So there is no need to be panicky if you have a genetic predisposition. Genetics determines only 3% of the heart attacks. So if you have a genetic predisposition, you can bring down the risk by taking appropriate medications and also adopting a more healthy lifestyle and also a more careful surveillance, that you look at your risk factors periodically, maybe every year, and then see if the pattern changes. And if there's any change in the pattern of risk factors or your symptoms, you need to pitch in on. That's all is needed.
Thank you. Swasti here wants to know, Dr. Meera, about PCODs. So, about what all lifestyle changes can one make to ensure that it doesn't impact her quality of life?
Thank you, Swasti. That was a very aptly coined question, because I'm very glad that you didn't quote treatment and you mentioned lifestyle changes, because PCOD itself is a lifestyle disorder. So the only way to reverse it or correct it is to bring in lifestyle changes. So we emphasize on all the 6 important pillars of lifestyle, first being a balanced nutrition. So watch your plate, not more than a 9 inches plate, where half of it should be full of green vegetables. A quarter of it should have the protein and another quarter the grains. The usual thali, where rice or roti makes the main staple, and small cups of the additional good fiber and protein should be replaced by this 9-inch plate. So basically, eat like a rainbow, with giving importance to the macros. So it doesn't just start with eating, it starts with grocery shopping. So plan your shopping accordingly. Try to avoid any kind of packaged processed food so your fridge does not store them. That is the best way we can get rid of them coming into our system. The second thing is keep moving. I do not necessarily emphasize on a one corner of the day being, started with all kind of intense workout and nothing for the rest of the day. That's not good enough. A small burst of activity, even climbing 3-4 stairs while at work, coming back to do your job, then taking a 10-minute stretch break, coming back to do your job is far more beneficial than one spurt of intense activity and nothing after that. So small bouts of small, sensible activity every now and then. 7 hours good sleep, good quality sleep in alignment with your biological rhythm. People say I get good quality 7 hours sleep, but they sleep at 1 a.m., get up at 9 a.m. That's not correct because it's completely in contradiction with your biological rhythm, and that's when the hormones go haywire. So watch out to respect the biological rhythm or the circadian rhythm. Of course, hydration goes a long way in maintaining because our body 70% is water. So we need to respect that as well. Stress management, definitely. So realize what stresses you. Not all of us can avoid stress, but we can respond to it in a positive manner rather than react to it in an annihilating way. So that is very, very important for us to understand what we can do about our lives. I know all of us are busy, but we need to make time to look after ourselves so that we are able to lead that busy kind of life. There's no point being busy and not being able to do it. So that is very, very important. And of course, making sure our weight does not increase because polycystic ovaries is pretty much weight dependent. They are like a chicken and egg. What comes first is definitely debatable, but lifestyle changes do make a huge difference to the reversal of polycystic ovaries.
So Meghna has also asked what small lifestyle changes actually make a real difference and what's just noise. So Dr. Meera has just explained to us what these small lifestyle
Consistency is the real
changes.
difference.
Yes.
Noise is enrolling yourself in a program.
Yes, I think I would also like to say that even if you, so somebody else also, Shalini Biswas asks, I don't have time for intense workouts. So do
You
small
don't
daily
need to.
habits actually make a difference? Yes, absolutely. I think they do.
Let me tell you one thing in perspective. A
Yeah,
mom who looks after a 2-year-old toddler expends more calories than a cyclist,
I suppose so.
but not appointing a nanny. That's what I meant.
Ah,
The
yeah,
nanny will become fitter. So
right. Dr. Srividya, let me again go back to the report because that's another very interesting finding. So there is a clear domino effect that we have seen, where what we mean by that is that it's just that it's not just one thing leads to another. So these things just keep stacking up. And once we start early with these conditions by the 30s, most individuals already have multiple conditions, one feeding off the other. So I just want to ask you, what is this effect, and how does this really, how does one affect the other? So also clubbing with the fact that how do these conditions cluster really and interact biologically?
Yeah. So I think till around 20 years back, we used to ask, okay, you have a family history of diabetes, so we look for diabetes. If somebody says we have family history of cardiac stroke or block, we look for that. And then we say if somebody has a family history of hypertension. And obesity is like, oh, everybody in my family has obesity, but they may not have any other problem. So this is how it was like siloed in different verticals. What we have seen is that as we are becoming more and more sedentary, as we are not prioritizing these early hormonal changes, especially in women, and infertility treatment, which is coming in at the age of 40 when they want to have a child. So we are already stacked up on a lot of things. One, genetic, irrefutable, aging, irrefutable, sedentary lifestyle adding to it. So what do you mean by layering here is that we start with obesity, which is the first to come, and it comes with teenage obesity, probably even much earlier, where you would have been born as a chubby baby is what is called. We don't realize that probably the mother would have been diabetic or the grandmother would have been diabetic. Mother would have had gestational diabetes, not checked. Any child who was born 3.5 kg and plus is an overweight child already. So the kid may lose weight during the later life, but again as they grow beyond teenage, obesity is the first thing to come. The next to come is dyslipidemia, which we actually do not treat till they develop either diabetes or they reach menopause. The third is the hypertension to come. And the fourth, final, is what the pre-diabetes converts into diabetes, and then everything crashes. But the minute you are diabetic, your hypertension, your blood pressure needs to come down to a very low level, which is below your normal. 120/80 is for everybody. But for diabetic, we want the blood pressure at 110/80 or 110/70. Cholesterol, if 100 is your cutoff for LDL, 130, for diabetic, we want it at 100. Because with diabetes, the risk of complication has just increased 100-fold. So the minute we say obese, I'm only obese, well, control the obesity early on. Be aware that your blood pressure has to be always normal. Cholesterol can be managed with lifestyle and changes till you hit menopause or you develop diabetes. The stacking up of NCDs is hitting earlier and earlier now, with women developing diabetes at the age of 35. So by the time they hit menopause at 45, their cardiac risk is already on the higher side.
Right.
That is the scary part of our report.
So, Dr. Asha, I wanted to ask about taking off on what Dr. Srividya just said about the stacking effect. And we know that one can lead to the other and can cascade. But what is the point, because the real thing to really understand is that there is a point where you can reverse it all. And there is a point when you can't reverse it, you have to manage it. So what is that point? And most of everybody would like to kind of identify that early and reverse it if possible, rather than just reach a point of no return and then you have to live with it. So is there such a point for heart disease or for any other of these conditions? Hypertension.
Very valid question. So let's look at some of the risk factors. If you look at obesity, you should start reacting when you're just overweight. An ideal BMI, the body mass index in an Asian person is 23. So when you're hitting 24, you should start acting on it. So many people think, okay, I'm a little plumpish and I still look good. That's not the point, but you're going out of range. So that is the point when you have to start reacting, and overweight, you start becoming, and that is the point where you can reverse it. Because what is achievable through lifestyle changes is usually 3 to 6% weight loss. So by the time you reach your BMI is 27, 30, it's again very difficult to get back. You need intense lifestyle changes, may not be enough. You need drugs. You need beyond 35, you start needing bariatric surgery. So that is the point where you have to become more conscious. You're not in the optimal weight range, that is 19 to 23 BMI, you're out of range, you should start acting at that point of time. And when it is diabetes, in the pre-diabetic stage, your HbA1c is between 5.5 to 6.4, it's still reversible. Beyond 6.5, it will be difficult, but it's just 1 or 2 years into it, you can still reverse it. But beyond 7, you start needing drugs. It will not be reversible. Similarly, blood pressure, you're in the pre-hypertensive range, that is 120/80 is normal, more than 130/80 is hypertension. You're in between, you should start acting. You should start shedding your weight, you should start more exercise, limit your salt, sleep better, and look at your reversal. So these are the times when you can reverse. But if you're already reached a grade 2 hypertension, if it's more than 150/100, there's no point in trying to reverse it. Now you have to take drugs and optimize your lifestyle changes. And once atherosclerosis sets in the body, atherosclerosis is a progressive disease. You need medications lifelong. You cannot stop it only by lifestyle changes. You need continued statin therapy and probably an antiplatelet therapy as well, because it's a progressive disease. And once atherosclerosis, that is, you have developed blocks either in your carotid arteries, in the arteries to your heart, or to the legs, you start taking medications, which needs to be lifelong. Many people think after a heart attack, if they are okay for 5 years, they think that it's okay to stop the medicines because now they are trouble-free and they've had a stent and it's all fine. That's a very wrong concept. Atherosclerosis is a progressive disease, so you need to be on continued medications, and it can only be you can only slow down the progression. You cannot totally stop it at that point of time. In fact, WHO has said if every person who's had a heart attack takes a statin, takes an aspirin, takes one AC inhibitor or a beta blocker, these four drugs, you can bring down 60% the cardiovascular mortality in the world. So it's very, very important to know where lifestyle
drugs.
changes alone will not be enough and where you need medications and professional guidance as well.
On the same note, I would like to emphasize to the women. Women come asking me in my menopause clinic whether they can stop blood pressure medication. They can stop because they're now adapting all the lifestyle practices. I insist to them that they should continue the medication plus the lifestyle because the medication will prevent them having complications of these metabolic disorders. It cannot reverse them. So, because it has gone beyond a place where it can be reversed just by lifestyle. So, both have to go in parallel so as to minimize the complications of these NCDs. That is very important.
Thank you, Dr. Meera, for pointing that out. I think I'm going to ask you this other question too about looking at another finding from our report, which talks about looking at some value in isolation. So one example that we did see was the HbA1c, which viewed in isolation, of course, it's a gold standard test. Of course, it's evidence for diabetes. But in a country where anemia is prevalent, sometimes can be not quite accurate. So there is also this tendency that, if somebody has a thyroid disorder or somebody has a diabetes, or they just keep testing the same thing again and again in isolation, or maybe,
Yes.
individual tests are kind of, so what can clinicians do to educate people on over-reliance on single parameters?
Yeah, we are not just numbers and we do not treat lab reports. You you actually look after holistically the individual. And I think now doctors should become Sherlock Holmes, or individual practitioners should recognize patterns rather than look at isolated numbers. A very classic example is HbA1c. If you're anemic, already the hemoglobin is low, it's entirely bound to be showing a HbA1c, which is actually falsely lower than the actual number. And then that will prevent you or stop you from recognizing how significant the diabetic control problem is. The second point is, again, the thyroid. The thyroid is one nightmare situation. Elderly people just go by the TSH and they take thyroid without probably sometimes being told by the physicians, or erroneously told a higher dose by the physicians. Menopausal women tend to develop weaker bones, and keep on increasing the thyroid medication can contribute to worsening osteoporosis without giving due respect to the holistic picture, because TSH levels can be high in obese women. And obese women are also prone for osteoporosis if they are not doing the proper strength training, because the muscle mass goes away and all that is fat accumulation. So seeing things in isolation and taking just based on the reference values, which many of us, including our women clientele, are known to do, because they look at those block letters and say minus come as red, or the front page is the summary of all the bad stuff. So I'm in the bad stuff. So that should not unnecessarily cause a false alarm. At the same time, should not cause a false degree of complacence at the same time.
Right. Dr. Srividya, I wanted to expand this point a bit and ask you about how people, I mean, today, apart from Dr. Google, we have Dr. ChatGPT, we have
Oh,
Dr.
yeah.
Claude, we have name it, we have it. And
Yeah.
they all extremely expert at advising everyone. So what would you like to, and I think a lot of people do that because they want to kind of reassure themselves, or they want to find out, or they think that, they should also know as much as the doctor. And many times it's also a question of people who don't have time, and they just want to kind of look up symptoms. So these online sources, what would your advice be to our audience on interpreting, your own results or somebody else in the family? Why is it important to, take medical advice these situations?
I will add the social media influencers to this list, wherein there is a very big joke going that somebody wanted to
I'm
go
just going to
on.
add one more question. Somebody has asked if yoga can reverse hypothyroidism. I don't know, as told by some Swami Ramdev ji. I don't know. I'm going to ask you to comment.
I, with due respect to every knowledge person out there, it is very, very important to, like Dr. Meera said, to interpret each and every report as a personalized algorithm. What may be right for me may not be right for you. My weight difference is going to affect my thyroid, my requirement, my diabetes, my anemia. So, what is true for, I mean, there have been a lot of instances where the lady who developed hypertension continued to take, she just randomly started taking her husband's medicine because it was BP medicine for him also. So,
Correct.
without realizing that she has developed a renal artery stenosis and she's not supposed to be taking those medicines. Very, very, very important is one, no single test is going to be a gold standard for a human life, which is at least 6 feet tall. We cannot measure. When we look at a car servicing, which has probably some 3,500 parts, and you are ready to do it annually, you're looking at a human body which has million and trillions of body parts and cells. It definitely deserves one level of expert opinion about, okay, you are right, you are not right, whatever it is. And also interpretation of the report is not range. And by the way, there is no one dot there saying that this is the right. There is always a range, and the range interpretation comes with experience of going through the medical law school, understanding it. So if anybody comes and say, oh, this is the one test you need to do, because in Insta you will see HSCRP, do HSCRP, it is going to tell you your cardiac risk profile, but without lipid, if your LDL is not high, if your what is HSCRP going to represent? And like Dr. Meera said, thyroid is something which is very, very weight driven. The point here is that if you are obese, which is what 90% of Indians are today, if we are able to bring down 20% of our baseline weight, which is what you are from your height, the BMI, and you are able to bring down 50% of your body composition analysis, the fat which is there, you may be able to reverse your diabetes, your blood pressure control will be peak, you may need minimum medication, you're bringing down your cardiac risk, the fatty liver does get reversed to quite a lot of extent, and you are no longer in the red zone. That is why it is important that you need to go and talk to the expert
Absolutely.
and know, yeah.
I think time has flown by so quickly. I really don't know how much more time we have, but I'm going to kind of ask you a rapid fire round specifically addressed towards women entrepreneurs and, their concerns, which is work pressure, stress, long hours. So I'm going to ask uh, Dr. Asha, uh, flights, late nights, food on the go. How much of damage is this doing silently?
Yeah, absolutely. When you ask lifestyle changes, some of the people who are in high profile work, what they say is, I'm traveling all the time, I'm on the flights, I take unhealthy food, I don't have time to exercise. And this is what we get to hear. But again, it's a choice. You have a choice. You're waiting in the airport for nearly 1 hour before you get into the flight. Just walk on the airport corridors. In fact, one of my colleagues says, people in the airport, they always know that he will go for a walk because he's going for so many meetings and he's always walking in the airport. So it's choice. You can walk there, count your footsteps. You can definitely walk there. And what food you take is again your choice. If you're thirsty, you drink water and not juices and not energy drinks. You take water. That is very, very important. And in the flight, again, you don't have to eat everything which is offered to you. You make a choice. You can have more water. It's very important that in flight you keep yourself very hydrated. So take a lot of water. You can take the vegetable salads. You can take the soups. You can take healthy, just a bun and some other food. You can take a yogurt. So limit your food to how much you need. When you're full, you stop. You don't have to, or half full, you stop. You don't have to eat because everything is offered to you, because different people have different needs. And you just eat what is required for you and limit it. Not just because you're bored, you don't eat. You eat for your nutritional requirements, and that will definitely help you. And late night flights, again, eat before you leave. That will, an early dinner is very important. You can finish your dinner and then go on to your flight, or just have some fruits and water. You will not die. You'll be quite fine. So just try to do that and you should be fine. Choices are yours. Make conscious choices for a healthy habit.
Absolutely. Dr. Meera, quickly, coffee, energy drinks, sugar hits, are we fueling productivity or harming our metabolism?
Too much of anything is anyway harmful. But sitting in Chennai, I'm not an anti-coffee person at all. So
We are
you're
not.
allowed a cup or two of this good antioxidant, but anything more than two is bad for your bladder. You need to see me after that. So better not to hit more than 2 cups of coffee or tea.
And finally, Dr. Srividya, 8 to 10 hours at a desk, back-to-back calls, is sitting the new smoking.
Oh, absolutely. It has been the
Yeah.
news for the last 15, 20 years. So the idea is that for every 45 minutes of dietetic sitting, 15 minutes of extensive physical activity, which may be your 10,000 step and all, and you can do it either accumulated in the morning or in the bits and pieces. But mobility, or what do you call it? The movement is your right and responsibility to your body. So sitting is the next smoking, and a lot of these NCDs are here because of the sedentary lifestyle. So yes.
I think we are really out of time, but I think, we could just go on and on. It's been so lovely to talk to all three of you and to you, dear viewers. So this, some of you did ask about this report, and we have posted the link there on the chat. So please read it, and just remember that your body always keeps count. So health isn't to be ignored, and you can't postpone it. Because what this report tells you is also the same thing. Disease doesn't arrive all packed up one morning. It builds quietly over time. So it can be slowed, it can be delayed, it can be reversed if we act early enough. So we encourage all of you to take charge of your health, and do look at the report too when you have time. And please remember that it's just not about your work, it's not just about your productivity, it's not about your financial prosperity, but I think everything depends on your health, and it's something that you can do for yourself and for your family and for the society at large and for our nation. Thank you so much for joining us. Take care. See you soon. Namaste.
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 Thank you.
Thank you.
Thank
Dr.
you.
Srinidhi,
Thank you.
Dr. Meera,
That was
Dr.
wonderful.
Thank you very much. Very nice
It
talk.
was lovely.
Thank you all.
Enjoyed talking to all of you. Thank you so much.